I will bring it back for comment before I allow a brief close from Assemblymember Kalra. I want to thank you, Assemblymember Kalra, for your continued commitment to making sure that every Californian has affordable, quality health care, and for your commitment to continue to work on this bill and this framework. Each time this proposal comes forward to the legislature, we get incrementally closer to achieving health care as a right that all Californians deserve. This bill seeks to address what is wrong with our current system, a healthcare system that is expensive and unequal depending upon insurance type. We've made enormous strides since the implementation of the ACA, where the uninsured rate has fallen and consumers' protections have made healthcare more accessible. Still, barriers exist in healthcare delays and increased premiums and out-of-pocket costs. And in fact, we sit here as a health committee week after week hearing legislation that attempts to try to fix this Frankenstein of a system. In this agenda alone, we are seeking to make sure that we have coverage for menopause, that we have newborn screening programs available to everyone, that we can ensure that our clinics are adequately covered in supporting controlled substances, that our distressed hospitals are not closed when they need to with St. Rose Hospital, that we ensure we have financial solvency for our different boards, that we ensure that we have awareness around abortion services in the way that we need to, and we go on and on and on. Human milk, with aspects of our healthcare system that continue to not serve every Californian. I know that you have been in this struggle for a very long time, and I want to thank each and every advocate who took time to come here to the state of California and in this hearing room to contribute your voice to what we need to ensure moves forward. We know that this is just a framework that you are starting with, and we know that you purposely separated the framework from and the policy discussion from how we would fund that. And I think that was a smart way for us to go, because it provides an opportunity for us to take a real hard look at some of the policy components. And I think you heard from committee members some aspects of this policy framework that still need significant work for us to be able to move forward. And I know that you will take heed with those aspects and continue to work on those should this bill be able to move forward. I support this bill today. I supported Assembly Bill 1400. I respectfully ask to be a co-author at this time on this bill. And I know that you will continue, as I do, to support every Californian in this conversation to ensure that we have adequate health care for everybody that is affordable. I want to thank you for your work, and know that we will continue with all proponents and stakeholders throughout our healthcare system to move towards a better California with this legislation. So with that, we were optimistic in our count. We did not actually have quorum. With 8, we need 9, so we are going to establish quorum and refer back and vote on this bill. But I will give you just a short 2-minute close.
Well, thank you so much, Madam Chair, for your longtime support of health justice, and for being so gracious and giving me credit when there's folks behind me that have been in this fight way longer than I have. And I would simply say that I'm so grateful to my colleagues, to those on the Health Committee. I know many of you have been fighting in so many different ways to increase access. But the reality is, we know our system is broken. It's unsustainable. And the reality is that with the most expensive system in the world, we have to ask the question, who's paying for it now, and how are they paying for it? We're paying for it out of our paychecks. We're paying for it out of gathering all of our life savings. We're paying for it by making choices over food versus medication versus housing. We're paying for it with lives lost in the streets. We're paying for it with the highest number of those entering into homelessness being seniors, because they get into a medical emergency and they lose their home because they can't pay their debts. The reality is that we know there's a better way. We know there's a better way because not only do other places do it, but every legitimate study has shown that we have the most convoluted, expensive, and unjust and immoral system that you could possibly create. We can do better, and the reality is that we know a state is going to lead and be the first one to do this. It must be California. California is the one that can do it because we have a large enough GDP. We can make it happen. And ultimately, it's not going to be easy. I do really appreciate the feedback, especially on the policy components of this. Dr. Weber, Assemblyman Schiavo, we're going to take all that into account and keep moving it forward. But the reality is that it does seem like we keep on repeating ourselves by bringing this bill forward and forward. But the reality is also that we're not going to stop. And Nelson Mandela once said it always seems impossible until it's done. And the reality is that we together cannot stop because people are dying. And we know that every single year we have a system that is profiting the very few while the masses suffer. And so I urge support of this bill when there's a motion for it. I'm so grateful to the chair. I'm so grateful to the co-authors, our sponsors, and everyone here in support and everyone around the state in support. I'd be so grateful for your aye vote.
Thank you. That concludes our special order of business right now, and thank you so much, Assemblymember Kalra, for presenting AB 2200.